As states consider taxing opioids, drug makers push back. So, I've been hearing a lot of things about the opioid crisis, and apparently it is so bad that it seems like each week there's something in the paper, something in the news about the death toll rising. And that is considerably a huge issue nowadays. And it's scary because this is not like, people that are drug dealers necessarily, but it's like the big pharma companies. And people could be easily prescribed medicines and not know the severity or the effects that come along with the medicines. And I always felt like the medicine industry was always in business as long as you have sick people. And so I always felt like not all illnesses were really viewed as we really got to find a cure. Because if they find a cure for every illness that exists, there's no need to go to the doctor. There's no need for drugs to cure it. There's no need for pharmaceutical companies. And they would be out of business if they didn't have sick people. And so naturally, people are going to get sick. Yeah, I just did something about the flu. And with this right here, this opioid crisis is really, really gotten out of control, apparently, to the point to where they want to tax opioids. And it's really a big problem now to where at first it was like they were looking at it and then they were recognizing it, and now it is like a national crisis. So, St. Paul, Minnesota, AP, facing a rising death toll from drug overdoses, state lawmakers across the country are testing a strategy to boost the treatment for opioid addicts, force drug manufacturers and their distributors to pay for it. And so now they're demanding that they fix this problem. So bills are introduced in 15 states that would impose taxes, or fees on prescription painkillers. Several of the measures have bipartisan support and would funnel millions of dollars toward treatment and prevention programs. So in Montana, State Senator Roger Webb, a Republican, sees the approach as a way to hold drug makers accountable for the overdose epidemic that in 2016 claimed 42,000 lives in the US, which is now looked at as a record, which is a very sad record. You're creating the problem, he said, and you're going to fix it. Opioids include prescription painkillers such as Vicodin, Oxycontin, as well as illegal drugs such as heroin and illicit versions of fentanyl, which I've heard fentanyl is extremely lethal and among all the other drugs. Public health experts say that the crisis started because of overprescribing and aggressive marketing of the drugs that began in 1990s. So this began way back in the 90s when people really weren't really looking at it as much as being a problem. The death toll has continued to rise even as prescribing has stopped being as frequent. So it has dropped. They know this is a crisis and they know people are taking more serious notice of it. And so they're not prescribing it as much, but the damage is already done pretty much because you have now what we're dealing with people who already have been overprescribed these drugs and they have either overdosed, died, and you have people who are extremely addicted and they can't kick the medication. So, opioids include prescription painkillers, and that is what is really scary. So, if it's prescribed, people have it in their mind, well, if it comes from a doctor, it must be safe. And so, there's a lot of people I know who, even myself included, who have taken Vicodin for maybe, like if you have like some kind of tooth problem, or if you had some type of pain and the doctors prescribed it. It's just fortunate I wasn't one of those ones that has become addicted to those medications. So, a Pennsylvanian opioid tax bill was introduced in 2015, and a federal version was introduced a year later, but most of the proposals arose during the past year. So the majority of them have yet to get very far, with lawmakers facing intense pressure from the pharmaceutical industry to scuttle or soften the legislation. So drug makers and distributors argue that it would be wrong to tax prescription drugs, that the cost increase would eventually be absorbed by patients or taxpayers, and that there are other ways to pay for the addiction treatment and prevention. We have been engaged with states to help move forward comprehensive solutions to this complex public health crisis. And in many cases, we have seen successes. Priscilla Vanderveer, a spokeswoman for the Pharmaceutical Research and Manufacturers of America, has stated, however, we do not believe levying a tax on prescribed medicines that meet legitimate medical needs is an appropriate funding mechanism for a state's budget. So, two drug companies that deployed lobbyists, Purdue Pharma and Pfizer, responded to questions with similar statements. A spokeswoman, or spokesman rather, for the Healthcare Distribution Alliance, which represents drug distributors, the end of their care might not be able to get the prescriptions they need. So the pharmaceutical industry has emphasized that the name brand drug companies that make up the members already give rebates to states for drug funded and Medicaid. So those rebates amount to billions of dollars nationwide that states could use to address opioid addiction, and the trade group has said. So state legislations to tax opioids comes as manufacturers and distributors are defending themselves in hundreds of lawsuits filed by state and local governments seeking damages for the toll of overdose epidemic that has taken on communities. So if I'm going to stop, there are some if you have Netflix, or if you have like Fire Stick or some of the other little like Chrome, um, like if you have like some system where you can see some of the docu series or the documentaries on this issue, it's so sad because you see the people who are heavily addicted on the drugs, to where they even the programs, it doesn't look like, even if they have programs, it doesn't work for everybody that well. And then those who do kick for a while, they tend to go right back again because their body craves it, because they've been on it for so long. Their body is just sort of heavily addicted to the drugs, and it's that strong. So it goes on to read that David Humes, whose son died from a heroin overdose in 2012, has been pushing for an opioid tax in Delaware, which did not increase funding for addiction treatment last year as it struggles to balance its budget. So when you think about the fact that each year more people are dying, if you leave the money the same, you're not keeping up with this public health crisis, he said. Humes, a board member of the advocacy group at it's coined as Attack Addiction, supports legislation that would dedicate opioid tax revenue for addiction services. And like I said again, I've seen some of the docu series where they had like a drug court, and this judge, she basically was trying to give people who were heavily addicted to opioids like a second chance. And some would kick the habit, and some said they crave it so much that they would go and spiral right back into the drug habit. And you'd literally see, like, I believe Virginia was one place. There was some other places where you'd see people who they said that every week it's regular that they'll have the fire department or they'll have EMS come out, and they were trying to revive people, and most of the calls are about opioid overdoses. So the lead sponsor of the opioids tax bill, State Senator Stephanie Hansen, said drug companies told her they already were contributing 500,000 to anti-addiction measures in Delaware, and where there were 282 fatal overdoses from all drugs in 2016, 40% increase from the year before. My response is that that's wonderful, but we're not stopping there, said Hansen, a Democrat. And she had said if her tax measure had been in place last year, it would have raised more than $9 million. The drug industries, our industry, current spending on anti-drug addiction program has been a point of contention in Minnesota legislatures. So there, the overdose rate is lower than most states, but the opioids still claimed 395 lives in 2016, an increase of 18% over the year before. So State Representative Dave Baker, Republican whose son died of heroin overdose after getting started on prescription painkillers, said that opioid manufacturers and distributors should pay for the drug program separately. He said the rebates, about 250 million in 2016 in Minnesota, is intended to make up for overcharging for drugs in the first place. So another Republican lawmaker, Senator Julia Rosen, said she walked out of a meeting this month with drug industry representatives saying that they were wasting her time. And so they know that they're spending way too much money on defending their position instead of being part of the solution, she said. Representatives of the pharmaceutical industry say that they have met with Rosen multiple times and are committed to continuing working with her. So drug companies have a history of digging and to defeat measures that are intended to combat the opioid crisis. So, a 2016 investigation, the Associated Press, which is AP, and the Center for Public Integrity found makers of opioids and their allies spent $880 million on politics and lobbying in 2016 through 2015. So that's a lot of money for this crisis. You know, when they always talk about we need money for certain things, well, a lot of our money is being put into creating programs for this crisis. And I've seen how some of these programs don't look like they're really having much effect on the people who are heavily addicted. And then whatever is in that drug that is so strong that when they prescribe it to people, they just seem like they're hooked. And so a lot has been said too in respect to a different social class and groups of people. And so and I can attest to this that, you know, I lived in a neighborhood where crack cocaine was just as addictive and lethal at the time as this opioid crisis. And all of this money that they're using for these programs and to talk about these issues and to try to help people with this particular problem, I don't see, or I didn't see rather, the same thing happen back in the 80s when it was happening to the Black communities. And so it was really bad. And people were heavily policed, they were jailed, They were accused of either being part of the problem, either they're the druggie or the drug dealer, and they were treated in a way where the druggie was more treated like as if he was the drug dealer as well, like he was part of the problem. And so it's crazy. It seems like a lot of money is being spent on this in particular. And I'm noticing that a lot of this is really hitting the areas where the primary population is Caucasian people, white people. And so it's sad on either end, whether it's Black people, white people. But the thing that is most telling is that whatever's in these particular drugs, it's so addictive and so lethal that even when they have these treatment programs, they seem not to really work. And so it goes on to say that the industry so far has succeeded in stalling the Minnesota legislation, which would charge opioid manufacturers by the dosage. So, with the bill facing resistance, Rosin and a Democratic co sponsors, State Senate Chris Eaton said that they are considering changing tactics and amending it. So that could include raising the $235 annual licensing fee on opioid manufacturers or requiring drug makers and distributors to pay $20 million a year based on the proportion of opioids they sell in the state. And so that approach is based on one adopted earlier this spring as part of the budget in New York. So the only state to implement an opioid tax so far. Eden, whose daughter died from heroin overdose in 2007, said her goal is to find a way to create the fund and to fund a structure that will ensure addiction treatment is a routine or as routine as treating diabetes or cardiac arrest. So Mulvihill reported from Cherry Hill, New Jersey. So people, but it just seems like this has really gotten so far out of hand and out of control that they put so much money. I'm going to read this again. I'm just taken back. It says in Montana State, Senator Roger Webb, a Republican, sees the approach as a way to hold drug makers accountable for the overdose epidemic in 2016 that claimed 42,000 lives in the US, which is now considered a record. So if you don't die of flu, there's the opioids, Vicodin, and all these other things. So it's crazy. And so there's many different, news stations that talk about the crisis, but they did show one where you could see people in the bus, look like a subway area, and they're just like shooting up in broad daylight in front of people. That's how it's just really bad. And I just never thought it would be to this magnitude, but I heard various videos and people, talk about it and, relate it to some of the things that I talked about, like back in the 80s or back in times, even before when people had like, real strong addictions to these drugs, and people would turn a blind eye because it's a poor community or it's a community where it's nothing but just like a high concentration of Black people, and they're not really viewed as being, worth saving. But this right here, just look at, if you listen to all of the money that they're putting forth in efforts to do all of this. And you could very well say, well, maybe it's because it's different persons that are being, stricken with this. It's, when it was Black people, I've heard this statements when it was Black people, it wasn't really looked at as a crisis. It was looked at as more of a negative, a problem, rather than a crisis. that needed attention, now national attention, but now you've got this here, big pharma and all this. And so this is really a big problem. And you know how they always say there's no money for this, no money for that. And could that also be a reason why we have more homeless people as well? Because from what I've known, once people get involved in this type of life where they're addicted to drugs, they pretty much virtually they're not able to thrive in life, like they did before, and they sort of spiral downward where they lose, track of reality, and all they search for eventually is the drugs, to where they lose their families, lose their homes. They could become homeless. And so this might be one contributor as well. But anyway, uh, give me your feedback, like, comment, subscribe, and thanks for listening. It's so sad that this is happening, but this is also a place where the US and probably other places as well, because I'm sure this drug travels from this country to other countries. Before I leave this video, I saw something really disturbing. I don't know if people know about this, but I believe it was called crocodile. This drug was so terrible. It looked like it was a flesh-eating disease on people, where you could see where literally their body looked like holes in their body, but they wouldn't stop the drugs. You think if you saw something like that on you, I'm gonna stop this. Is dang, I'm gonna die. But those people were so heavily addicted on this what is called crocodile, they just kept taking it. And you can see where their bodies literally they smell bad. Their bodies, it's like the living dead. And whatever was in that, it was so heavily addicted. They were addicted to it that they just couldn't quit taking it. Even if they seen literally holes in body parts, they're losing body parts, and it was awful. It was awful. It was just like they were pretty much signing their death certificate in real time. And yeah, something's got to be done about it at some point. But there comes a time where there's some things, some people, not all people will be able to be saved, unfortunately, because they've gotten too deep in whatever it's done to them. The damage is already done, unfortunately. So like, comment, subscribe, and thanks for listening.